Well, hello, and thank you very much for clicking on this video today. Um, an interesting story. I think you would think most people would agree. So this is about how the Department of Work and Pensions wastes considerable amounts of money by reassessing people for personal independent payments or PIP, despite the fact that their conditions are permanent and aren't going to change, like reassessing amputees, just as an example. So this is a story that's coming from the Canary. So let's just go through the details with it. So, the Department of Work and Pensions is wasting money by reassessing people like amputees in case their conditions has improved. So this is coming from a Downing report by anti-poverty charity uh, Z2K, has uncovered that hundreds and hundreds of disabled people endure a grueling personal independence payments reassessments, despite the fact that their conditions are lifelong or progressive. So they're not going to change. Like arms aren't going to regrow, legs aren't going to regrow. So let's just go into the details again. So the Prove It Again report found that 86% of amputees were given fixed term PIP awards, meaning that they're required to undergo regular reassessments. These reassessments determine whether someone's disability or condition has changed. The other conditions given fixed rate awards include 62% of claimants with cerebral palsy, 73% with learning disabilities, 61% with Parkinson's disease, 98% with multiple sclerosis, and 93% with chronic obstructive pulmonary disease. And none of those conditions are going to change. If anything, they're going to get worse. And to Samuel Thomas, the policy advisor at Z2K, said, "Disabled people should not have to keep providing or proving the same thing over and over again when their condition is not going to improve. Routine PIP assessments are causing needless anxiety, hardship, and bureaucracy, with little evidence that they are saving money." So this is all about trying to see if someone's condition has improved so they can reduce any benefits that they might be getting. But as it's obvious to anyone, amputees, people with cerebral palsy, people with Parkinson's disease, people with multiple sclerosis or chronic obstructive pulmonary disease, their conditions aren't going to change for the better. So why in the name of Christ are they being reassessed? You know, as I said, it's not as though their legs are going to grow back, is it? So the charity also found that 74% of reassessments resulted in no change to someone's benefit entitlement. So this is a complete waste of money. They go for all these reassessments, and to the vast majority of the cases, it makes no difference. But for many, they couldn't actually get more money, as 28% of disabled people whose awards stayed exactly the same already received the highest level of PIP. Therefore, all that happened was that severely sick or disabled people were just put under unnecessary stress. And interestingly enough, WP PIP increases have actually nosedived since the Labour government took over. Between November 2025 and January 2026, less than 1 in 15 PIP claimants saw an increase in benefits after reassessments. So, just to go through the kind of how the PIP process works, there are two types of PIP awards: fixing and ongoing. Anyone who receives an ongoing award is left alone for 10 years, then has to complete a 6-page form to say whether their condition has changed at all. Anyone on a fixed term award must be reassessed every few years and fill out the initial form again, which is more than 40 pages long. And you might think, well, why do they have to keep filling out the same form? Isn't this kept on file or something? Well, no, the forms aren't kept on file, so you can't just say there's been no changes. You have to go through the exact same bureaucracy again and go through all the excruciating detail. You'll then be reassessed by often an unsympathetic assessor who is often not trained in safeguarding. And so we've got a few quotes from some of the people that have gone through this process. So one disabled person told Z2K that the review process made them feel like they were a criminal in a court. They said, like I was being charged with crimes against being a disabled person or impersonating a disabled person. They said, They also added, it leaves me feeling like less of a person. Another reminder of everything I can't do. Instead of being allowed dignity to live my life as I know, I'm put through this ordeal. So the DWP's own guidance states that anyone who identifies with these descriptions should be given ongoing awards and spared reassessment. Um, And so a high level of functional ability, which is not likely to change in the long term, or high levels of functional impairment, which are only likely to increase. And so one thing to bear in mind is while PIP isn't an out-of-work benefit, people often fear that without an ongoing award, they could be forced into unsuitable work. And this is an unvalid concern given that the government constantly includes PIP claimants into out-of-work statistics. And the Joseph Rowntree Foundation found that PIP claimants are less likely to try work because they feel scared it will be used against them. Their survey on barriers to work revealed that 70% of people receiving work-related disability benefits worried that starting work could trigger a change in their circumstances for PIP. And interestingly enough, a Department of Work and Pensions memo confirmed that while entering work doesn't trigger award review, decision makers can decide to do so if they want to. And so people are often kind of caught in a catch-22. People that are on PIP who maybe out of work and thinking and wanting to get back into it, as the Department of Work and Pensions memo kind of confirms, can often face this dilemma of, well, if I do go back, I could be put in a financially perilous position whilst I'm looking for work, because I could be reviewed and what I receive could be taken away, because they can say, oh, well, your disability or whatever it is, it can't be that bad since you're looking for work, despite the fact that the Department of Work and Pensions and the government actively pushes people that do receive kind of PIP to try and go back into the workplace. And one thing to kind of consider is that there isn't, I can speak from a degree of personal experience, I worked in this field a little bit, is that there isn't a actual specific program for people that are out of work because of things like disabilities or ill health and are looking to get back into the workplace. It doesn't exist. All that really happens is you are just dumped in the same pile along with people that are just unemployed. So not only have you got people that may have been out of work for a few years that are facing that issue when it comes to being hired, but there is no program in place to help people kind of get back into it. So one thing that there are recommendations from Z2K, the charity, and one good thing that it says is that the Department of Work and Pensions is extending the reassessment period from 2 years to 3 years, increasing to 5 at a person's next review. However, as the article kind of points out, this isn't for the claimant's benefit. It's purely because the Department of Work and Pensions can't handle the amount of reassessment it has to complete. And Z2K has recommended that any claimant whose main disability or health condition is lifelong or progressive should be given an ongoing award. The charity also says there should be more streamlined reassessment process. If someone's conditions or needs haven't changed, they shouldn't be subjected to a review. And these are good recommendations, but it's I doubt that the Department of Work and Pensions will actually do anything with them. So kind of just summarising and kind of just going back, kind of working back around. There is no point in people assessing people whose health disabilities or health conditions are not going to change, or certainly not going to change for the better. Anyway, it's a complete waste of time and money. And whilst they're doing that, you can see that there is this backlog assessing of reassessment for people who their conditions may have changed. And as I have said, when it comes to kind of pushing people on PIP who want to work kind of back into kind of workplace, as I said, there is no actual dedicated system for those people. It doesn't exist. And the issues that those people face are quite particular, because some of them may have been out of the workforce for several years. They may need help trying to explain that to employers, and they also need a little bit of grace from employers as well, because even though employers aren't really supposed to discriminate people based on things like disability and what have you. There's data indicating that employers do. I mean, hell, this is a little bit different, but there's the famous, what do you call it? The very famous research done. I think it might be Harvard or Princeton. I can't remember. Where they took the same CVs and put on those CVs various stereotypical kind of African American names, and then submitted them, and found that ones that had very significantly stereotypical African American names were not called back or were not asked to interviews at the same rate as more kind of stereotypically white names, despite the fact that the CV was exactly the same. And I think that you can apply this kind of issue where it comes to employers, where it comes to people that have health conditions or have disability issues, kind of on their CV. Are they going to be invited to interviews? Are they going to get the same treatment as someone who doesn't have those issues? I doubt it. And all of these things, the absurd kind of rules around reassessments, and the real lack of any actual proper program to actually kind of help people kind of back into the workplace, and the fact that AI is rapidly taking jobs, all creates a substantial welfare bill. But anyway, thank you very much for listening to this video today, and I will catch you later. Bye bye.